Have you ever noticed how your body reacts differently to things as you get older? Maybe you can't handle spicy food like you used to, or perhaps that extra glass of wine hits you harder. It's no different with medications. As we age, our bodies process medications differently. This means what worked fine in our 30s or 40s might not be the best choice after 50. That's why it's crucial to be aware of common medications that can be risky for older adults. Some medications can have more intense side effects or interact negatively with other medications we might be taking. Knowledge is power. By understanding the potential risks, we can make informed decisions about our health and explore safer alternatives with our doctors. We want to stay healthy and active, right? Let's dive into the medicine cabinet and learn how to avoid potential hazards. Pain is a part of life, but as we get older, it seems to become a more frequent visitor. Whether it's a stiff back, achy joints, or a throbbing headache, we often reach for over-the-counter pain relievers for quick relief. But here's the thing, some of these common painkillers can pose serious risks for those over 50. We're talking about medications you probably have in your medicine cabinet right now. While they might seem harmless, it's important to understand that even over-the-counter drugs can have powerful effects. Let's take a closer look at two types of painkillers that require extra caution as we age: NSAIDs and opioids. Remember, our goal is to manage pain effectively while protecting our overall health. By understanding the potential downsides of certain painkillers, we can work with our healthcare providers to find safer alternatives. NSAIDs, or non-steroidal anti-inflammatory drugs, are a go-to for many of us when pain strikes. Think ibuprofen, Advil, Motrin, or naproxen, Aleve. They work wonders for reducing inflammation and easing pain, which is why they're so popular. However, long-term use of NSAIDs can be tough on our stomachs, especially as we get older. They can increase the risk of ulcers, bleeding, and even heart problems. If you have a history of stomach ulcers, heart disease, or kidney problems, NSAIDs might not be the best choice. So what's the alternative? Before you reach for that bottle of ibuprofen, talk to your doctor. There might be safer options like acetaminophen, Tylenol, or other pain management techniques like physical therapy or heat therapy that could work for you. Opioids are powerful painkillers that are often prescribed for severe pain. While they can be effective, they also come with a high risk of dependence and addiction. This risk is even greater for older adults. Opioids can also cause a whole host of side effects, from drowsiness and constipation to slowed breathing. These side effects can be more pronounced in older adults, leading to falls, confusion, and other complications. It's essential to have an open and honest conversation with your doctor about the risks and benefits of opioids. If you're prescribed opioids, always follow the dosage instructions carefully and be aware of potential side effects. Never hesitate to reach out to your doctor if you have any concerns. Section 5. The Sleep Thief: Dangers Lurking in Sleeping Pills. A good night's sleep is essential for our physical and mental health, but as we age, sleep can become more elusive. If you've ever found yourself staring at the ceiling at 3 a.m., you know how frustrating insomnia can be. Many people turn to sleeping pills for help, but certain types of sleep aids can be risky for older adults. We're talking about benzodiazepines and non-benzodiazepine hypnotics. These medications work by slowing down brain activity to induce sleep. While they might seem like a quick fix for sleepless nights, it's important to understand the potential downsides, especially for older adults. Remember, good sleep is crucial, but it's important to find safe and effective solutions. Let's explore the potential dangers lurking in these common types of sleeping pills. Section 6. Benzos, a slippery slope. Benzodiazepines, or benzos for short, are a class of drugs that includes medications like Xanax, Valium, and Ativan. They're often prescribed for anxiety and insomnia, but they come with a long list of potential side effects. For older adults, benzos can increase the risk of falls, cognitive impairment, and dependence. They can also interact negatively with other medications, leading to dangerous complications. The longer you take benzos, the more challenging it can be to stop using them. It's crucial to talk to your doctor about the risks and benefits of benzos. They might recommend safer alternatives for anxiety or insomnia, such as cognitive behavioral therapy for insomnia or CBTI or relaxation techniques. Section 7. Non-benzos, not a free pass. Non-benzodiazepine hypnotics like Ambien, Sonata, and Lunesta are often prescribed for sleep problems. While they work differently than benzos, they still come with risks for older adults. These medications can cause daytime drowsiness, dizziness, and confusion, which can increase the risk of falls and accidents. They can also worsen existing cognitive problems or lead to unusual behavior, like sleepwalking or sleep eating. It's essential to talk to your doctor about all your medication options and any potential side effects. There are often non-medication approaches to sleep problems, such as improving sleep hygiene or addressing underlying medical conditions that can be effective and safer. Section 8. Allergies and antihistamines. Choosing wisely. Allergies can be a real nuisance, causing sneezing, itching, and a runny nose. Antihistamines are medications that block histamine, a chemical released by our bodies during an allergic reaction. While antihistamines can provide much-needed relief, certain types can cause problems for older adults. We're talking about first-generation antihistamines like Benadryl and chlorotrimidine. These older antihistamines are more likely to cause side effects like drowsiness, confusion, dizziness, and urinary retention. Let's explore why these first-generation antihistamines might not be the best choice as we age and discuss safer alternatives. Section 9. First-generation antihistamines. An outdated approach. First-generation antihistamines are good at blocking histamine, but they also block other chemicals in the brain, which is why they cause so much drowsiness. As we get older, our bodies are less efficient at processing medications. This means the sedating effects of first-generation antihistamines can be more pronounced and longer-lasting in older adults. These antihistamines can also worsen existing health problems. For example, they can make it harder to urinate, especially for men with prostate problems. They can also worsen glaucoma or interact negatively with other medications. The good news is that there are safer alternatives. Second-generation antihistamines like Claritin, Zyrtec, and Allegra are less likely to cause drowsiness and have fewer side effects overall. They're available over the counter and can provide effective allergy relief without the risks associated with older antihistamines. Always talk to your doctor or pharmacist to determine the best allergy medication for your individual needs.